Now, I just gave a short overview on your platelet disorders. So let's try to tackle them one by one, depending on what type of disorder they would cause. So one of those, general category. When you say general category, this belongs to a certain group. Now, one of the platelets would be your disorders of platelet aggregation. So if you recall yesterday, di ba part siya ng primary hemostasis nyo. So in your primary hemostasis, meron kayong vasoconstriction, adhesion, aggregation. Now, yung platelets nyo could have defects on either adhesion or aggregation. So let's tackle first aggregation. So yung platelets nyo would have a problem in platelet aggregations, specifically yung glycoprotein 2B and 3A function. So ito yung nakikita sa parts ng platelet nyo which I've discussed yesterday. So one of the disorders under platelet aggregation is your so-called Glanzmann thrombasthenia. Now, this is an abnormal in vitro clot retraction. Ibig sabihin, class, hindi lumiliit yung sugat nyo. Your wound does not close down properly. Pero you have a normal platelet count. So again, if you have a normal platelet count, most likely abnormal ang platelet function. To simplify this, quantitatively, when you say quantitatively, yung number, quantitatively normal, pero qualitatively, abnormal. Now, this is an autosomal recessive disorder frequently seen in a population with a high degree of consanguinity. So when you say consanguinity, class, parang ano yan eh. Inasawa mo, let's say, you married your second degree or third degree cousin. Basically, consanguinity, you have a similar genetic frame-up. Related kayo by blood. You could be related by blood. You could be related by having a certain degree of relationship sa family niyo. So, common to class sa mga places na small ang population. Now, it would manifest itself in neonatal period or infancy. So, bagong panganak pa lang, it would begin na. Then, it is characterized by hemorrhagic manifestations. So, when you say hemorrhagic manifestations, class, nagbi-bleeding yung patient nyo. This would include petechiae, purpura, menorrhagia, gastrointestinal bleeding, and hematuria. So, let's discuss them one by one. Now, when you say petechiae, disconnect ako. Nakikita niyo yung screen, class? Ayan, okay na. So, pag sinabi niyong petechiae, class, ito yung tinatawag nating discoloration. Discoloration of the skin. Yun yung pasa sa Tagalog. Sorry, class, napuputol pala ako. Meeting ko. Your petechiae would be discoloration of the skin, while your purpura would be deep discoloration. So it would go under. Then your menorrhagia would be menstrual bleeding, abnormal menstrual bleeding with prolonged menstruation. Then gastrointestinal bleeding would lead to stool with blood, while hematuria would be urine with blood. Now, your lab features, as I said earlier, would have normal platelet count, normal platelet morphology, but abnormal function. The abnormal function here, there is no platelet aggregation. Now, your glycoprotein 2B and 3A functions as membrane receptor capable of binding fibrinogen, von Willebrand factor, and fibronectin. So, just to explain this class, ito yung sugat nyo. This would be the wound. So, magkakaroon ng vasoconstriction, magle-lessen yung blood flow. Dadating yung mga platelets doon, they would perform adhesion. Then, dahil abnormal yung glycoprotein 2B and 3A niya, there would be no aggregation. Yung fibrinogen na nako-convert into fibrin would not be attached to the platelets. Hindi magko-close yung wound. Hindi magko-close yung wound, and that would lead to bleeding. So this is the clinical manifestation class of your Glanzmann. So you have your dental bleeding, your epistaxis, which is your nose bleeding. Then there's even your menorrhagia, which is your extensive or prolonged menstruation, heavy bleeding. Then let's go to your disorders of platelet adhesion. So this time naman, class, may problem is your glycoprotein 1B, factor 9, and factor 5 function. So under here, class, is your Bernard-Soulier syndrome. Now, your Bernard-Soulier syndrome naman, class, is a disorder in platelet adhesion. Now, it would manifest itself in infancy or childhood. Now, the characteristics include ecchymosis, epistaxis, gingival bleeding. It is inherited as an autosomal recessive disorder in which glycoprotein 1B, factor 9, factor 5 complex is missing from the platelet surface or exhibits abnormal function. Platelets have normal aggregation response. So it usually presents early with the bleeding symptoms such as your epistaxis, nose bleeding, ecchymosis, continuous and gingival bleeding, menorrhagia, GI bleeding. Early patients will have severe hemorrhage at times of injury or surgery. Then another one would be your inherited giant platelet syndromes. Now, there will be the presence of your so-called large platelets and thrombocytopenia. Thrombocytopenia and bleeding tendency is mild. Platelet structure is normal. So you would have here, class, large platelets. So instead of the normal 2 to 4 micrometer, yung giant platelets nyo would have greater than 4 micro. Then another one would be for your secretions. So when I say secretions, class, this would again refer to your granules. Yung mga alpha granules nyo, dense granules, or dense bodies. So one of those would be your storage pool diseases. And under that is your so-called dense granule deficiency. Now, your dense granules, class, are the storage site for serotonin, nucleotides ADP and ATP. Now, in this type of disease, bleeding is usually mild and most often limited to easy bruising. Under that is your Hermansky-Pudlak syndrome. Hermansky-Pudlak syndrome class is an autosomal recessive disorder characterized by a tyrosinase-positive oculocutaneous albinism. So, papakita ko to. Oculo, meaning the eye. Cutaneous, meaning the skin. Albinism. So, if you've seen an albino, yun yung sobrang puti, pati yung buhok maputi. And there is defective lysosomal function. So, if you would recall, your lysosomes are used in killing or destruction of other cells. Then there is the presence of lethal hemorrhage. So ito yung tsura class ng Hermansky-Pudlak niya. So if you notice yung patient would be an albino, puti ang buhok, puti ang skin. Then if you notice the eyes, namumula siya. This is known as your oculocutaneous albinism. So you have a problem in blood clotting and breathing problems. Then another one would be your alpha granule deficiency. Alpha granule deficiency, wherein there is a gray, known as your gray platelet syndrome. Now, your alpha granules naman class are the storage site for protein produced by the megakaryocyte. You have your platelet-derived growth factor, PDGF, thrombospondin, and platelet factor 4. This is also an inherited autosomal recessive disorder. There is a lifelong mild bleeding tendencies, moderate thrombocytopenia, fibrosis of the bone marrow, and large platelets whose gray appearance on a right stain film is the source of the name. So dito class, yung platelets nyo would be very big and would appear gray instead of the normal blue color. So do remember class that yung alpha and dense granules nyo or dense bodies are storage sites of different products. So remember that your alpha granules can be the storage for proteins such as your PDGF, thrombospondin, and platelet factor 4. So this is the appearance class of your gray platelets. So they would appear hypogranular and a bit enlarged. And let's go to your other storage pool diseases. We have your Quebec storage pool disease, wherein alpha and dense granules are deficient. So this time naman class, both types of granules are lacking. This is an autosomal dominant disorder. So aside from the rest na puro recessive sila, this is the only autosomal dominant disorder. This would result from the deficiency of multimerin. So multimerin class is a factor 5. This is a protein, specifically your factor 5 in alpha granules. So are there any questions? So that was just an addition.